Are we ready to go?
We're ready to go.
All right, New Mexico, let's do our COVID update. And I'm delighted to be joining two experts that, of course, you hear from every week, Dr. Grace and Dr. Collins, respectively, our Secretaries of Human Services and the Department of Health. Nora, let's begin with the first slide. Okay, we are conquering COVID. And for this, everyone in this state should be incredibly proud. It will be a lifelong journey, but we should always be winning against COVID. And in fact, New Mexico is. And here's what's really helping us, not just turn the corner, but create the safest possible environment for New Mexicans. 41.6% of all New Mexicans who are eligible are fully vaccinated. And what I mean by eligible is, of course, if you're under the age of 16, there isn't a vaccine available to you. So 41.6, this is incredible. And as you know, New Mexico is leading the country in our population of fully vaccinated individuals. Now, given this number today, and given how many vaccines we're administering each week, and given that I believe that we're going to encourage and get more New Mexicans excited about vaccines, we believe unequivocally and know that 60% of eligible New Mexicans can fully get vaccinated in short order. And that number translates to New Mexico graduates from the color-coded county risk system. All right, next slide. All right, we are weeks away. 60% of eligible New Mexicans are projected to be fully vaccinated by the end of June 2021. And here's what that means. In 9 weeks, New Mexico, we are open. And this is cause for incredible celebration. And I'm extremely proud of all of our work getting to this point. All right, next slide. And it's Dr. Grace's slide. And before you go, Dr. Grace, and I hand that over, I really want New Mexicans to be proud, encouraged. I don't want you to let your guard down. I want us to keep conquering COVID. But I want us to fully embrace that New Mexico today is the first state, I believe, in the nation that can reach a percentage of population fully vaccinated that allows us to be fully open in the safest possible way. And this is amazing. And so I'm so delighted to get to make this announcement. And let's have Dr. Grace show us what data we're using and what it looks like for the next 9 weeks. Take it away, Dr. Grace.
Thank you very much, Governor. It's great to have you back at our press conference. Delighted. I'm really excited today. I imagine that I'm not the only one, but there are probably not many of us who get up every morning and up the COVID day number by 1 each day. We're 414 days into this. And I can't tell you how excited I am and have been for the past couple of weeks as we've been working this information to get to this day. And it really is an exciting time for everyone in New Mexico and state employees and others, government officials who've worked so hard to bring us here. So let's go to my usual first slide. It's the number of cases averaged over 7 days. The top line, the blue line, is the whole state. The 5 lines below it are the regions. And what you can see off to the right there is we've entered a new plateau. And if you look back, you can see there were a couple other plateaus, one that sort of started in April and another one that started in August. But the thing that's different about this plateau is that we have the vaccine going for us. You know, we're running an average over 7 days of 199 cases, about 200 cases. I think that flat line is actually a combination of an uptick in cases amongst folks just being out more and interacting more with each other, pushed down the other way by the effect of the vaccine. So the other thing about plateaus, when things are stable, it's a good time to reassess, good time to think about our metrics, set new goals and targets. And that's what I'll do for you today. You can see all the regions are in plateau, and we're still vaccinating every single day. For every one person with COVID, we're still vaccinating 60 New Mexicans. And so that's a great statistic that continues, as we said, at the beginning of January, a formula for success. And now we're here today experiencing that. Next slide, please. I wanted to first start by going over the new mask requirements from the CDC. And I know that Christine Ross and Chad Smelzer and I and Christine and Chad are at DOH and EPI. They're really excited about CDC coming out with guidance. Chad and I were talking today about remembering last summer when routinely New Mexico was 4 to 6 weeks ahead on our recommendations of the CDC. And we welcome them stepping up, taking national leadership. You may remember that we announced our school opening the same day they did, but now we have a couple days advance notice on the mask. We appreciate their guidance. And as much as possible, you'll see us conforming to their guidance when it makes sense for the people of New Mexico. So let's review what they said and what they didn't say. There's a lot of people have told me some things CDC said that I don't think they said. So first, outdoor activities. And this is where the real changes occur. On the right, you see 5 heads there of people. Those are fully vaccinated people. And you can see that 4 of the 5 don't have a mask on. On the left, you can see unvaccinated people there. And in the middle are those activities and how they apply to everyone. I also want to call your attention to the color coding here. It's going to be really important on the next slide, but here too, that for fully vaccinated people, the color coding is green, the most safe kind of interactions you can have. But for the unvaccinated people, there's less safe and least safe. And I'll say a little bit more about that in a minute. So I'm really happy as I was out walking this morning with my mask on for, I don't know, I've exercised every day of the pandemic thing. I can take this off tomorrow. Walking, running, biking outdoors with members of your own household, no one needs to wear a mask. If you're going to a small outdoor gathering with fully vaccinated family and friends, no one needs to wear a mask. I will talk a little bit about what small means later, because it's a very important word in this, but generally it will conform to the red, yellow, green, turquoise framework. And you can also attend a small outdoor gathering with fully vaccinated and unvaccinated people. Notice that this is where unvaccinated people need to wear masks. And then dining at an outdoor restaurant, again, really recommending, it's less safe for unvaccinated people to do that. We want you to do like the CDC, keep your mask on as much as you possibly can. And then lastly, if you're going to a crowded outdoor event like live performances, parades, sporting events, everyone needs to wear a mask, but again, less safe for those who are unvaccinated. So it's a nice framework. It's easy to understand. There's 2 links in here, and this is the infographic, but the detailed explanation is that second link on the bottom, and those of you who are interested, go and read more there, and we will be revising our public health order to account for these changes. Let's go to indoor activities, very different. First, you notice everybody has a mask on for everything done indoors. And of course, this doesn't include just being at home with your family. But again, if you look at the left side for unvaccinated people, some of these activities are less safe, and some of them are rated the least safe. So we should be aware of that. And I'm not going to go through each one. You can take time, but visiting a barber or a salon, it's back on, just keep your mask on. Going to an uncrowded indoor shopping center or museum, back on, keep your mask on, etc. So we'll be adopting these criteria. Appreciate the CDC taking the lead. And I know that for some of us, that means who spend a lot of time outdoors, we'll be able to do that more with masks off. Let me go to the next slide, please, Alex. I wanted to go over some changes to the gating criteria, and that means changes to the red, yellow, green framework as well. And let me start with the things in the yellow boxes. First, on the, excuse me, case investigation, isolation, contact tracing, and quarantine, we're just changing the name of that category. The measures are the same. Second most important thing is we're dropping PPE. It's just no longer an issue. And when we have things on these criteria, the hospitals have to report them every day. And so we're taking them off that hook for having to do that continuous reporting to the state. There's still some federal requirements they'll keep, but the key ones are we are raising the thresholds for New Mexico daily cases, that graph I just showed you, to 210 or less. And if you're, and that will translate, we're all familiar with the 168 or more familiar with 8 cases per day per 100,000. This 210 translates into 10 cases per day per 100,000. And also we're relaxing and increasing the threshold for test positivity rate from 5% to 7.5%. So these are important changes, and I'm going to show you how they are going to play out. We'll also be posting these and updating them on the gating criteria website once a week now, because we're really in maintenance mode, and I'm hoping we never get back to having any of these be a crisis again. Next slide. So the basic principle behind the red, yellow, green, turquoise framework has really been to identify those metrics that are the best measures of safety in communities. And up to now, we've been using case rates and test positivity rates, but our vaccination effort has been so successful that vaccinations themselves and vaccination rates have become an overwhelming driver of our success, and actually having this this press conference today with these announcements. So it's also important to remember that as we increase our vaccination rate, it affects these other 2 metrics. So case rates will continue to go down as more people are vaccinated. And interestingly, and maybe paradoxically, test positivity rates are going to go up, because as more people are vaccinated, less people will need testing when they've had a contact if they're vaccinated, et cetera, et cetera. Everyone still needs testing if you're symptomatic, so we all need to do that. So we needed to adjust this framework to adapt to these, and we saw the opportunity to add vaccines. And I need to say there's just been, I get a lot of emails in this work, but the last 2 months have been overwhelmingly positive from people saying, why can't we build vaccination rates into our red, yellow, green framework? So that's what we're doing today. Next slide, please. So let me go over the changes. We're adding the vaccine metrics. So we used to have two metrics, now we have 3. I already went over the 8 to 10 and 5 to 7.5%. We'll do that again. And then the vaccination target will be, starting next Wednesday, 40%. And I'll show you more data on that in a minute. And then it goes up by 5% every 2 weeks, every time we run the report, because as the governor mentioned, we're aiming for 60%. So if we go up by 5%, 8 more weeks from next Wednesday, which is the end of June, we will be at 60%. We're keeping the county adjustment the same. And if you look at the criteria, they look like they're almost identical, but there really is a huge advantage to counties, and you'll see that in a minute as well, because now you only have to have 2 out of 3 criteria to be green. And you can have 2 out of 3 criteria 2 times in a row to be turquoise. And so it actually makes it easier. Another way of thinking about it, if it makes more sense to you, is the vaccine, if you're at the state average vaccination rate, it gives you a boost. It moves you to 1 color better. And so that's how we're thinking about it. And then we will start calculating turquoise, another popular demand item from mayor's councils and economic recovery council, on a less frequent basis. So once a county gets to turquoise, they'll stay there for 4 weeks and they'll skip that 2-week recalc. So those are important changes. I'm happy to take more questions later. We're not changing the activities in the county. Those tabs on the red to green site about what you can do where are the same for the most part. And also want to emphasize that the criteria might be different in tribal communities. Some tribal communities have signaled that they'd like to be a little bit more careful, and that is certainly their sovereign right. Let's go to the next slide, please. So this metric specifically, because I know Julia Goldberg and others will want to know, it's you get credit if you've completed the full vaccination series. We know that's 2 Pfizer and Moderna vaccines or 1 J&J. The numerator is the number, and it'll be cumulative, of final dose state vaccines plus federal vaccines administered to county residents greater than or equal to 16 years old. And I'm going to comment in the denominator too, but we're not going to change that. So if new populations come on board, we're just sticking with 16 and over for the purposes of getting to where we want to be. And that's important. I also want to just really recognize Dan Sasson and Elizabeth Davis in EPI, who have found miraculously a way to translate the federal data, which initially we didn't really have very good data. When we got it, it was impossible to put into a county level. They have come up with a way of looking at these federal vaccines that are given and accurately assigning them to a county. So great work. And to give you an example of why this was important, federal vaccines are not administered equally across the state. Federal vaccines go to IHS, they go to some pharmacies, they go to federal correctional facilities, et cetera, Department of Defense. And so McKinley County, if you looked on the state map for vaccination rate by county 2 days ago, was the second from the bottom in vaccination rate. But today, if you go on the website, you'll see we're now presenting state plus federal data. They're number 1, I believe, in the state. So just shows the importance of building that federal data in. And thanks again to everyone in EPI who made that actually possible. The denominator is just the population in the county. And all you have to do to meet the metric is be at or above the target every 2 weeks. And remember though, this is a moving target, and we've been criticized in the past for moving targets, but this is one that's essential to reopening. And so we want that target to move and to go up every 2 weeks to get us to 60%. And that really amounts to only 42,015 New Mexicans fully vaccinated. The graph on the right, the red solid line, shows how many people we've fully vaccinated per week this year by, I think it's every week or 2 week period. The dotted line behind it is just the trend. And you can see we're continuing that starting next week with, it should say 40%, 45, 50, 55, and 60. So that's the plan. That's how that measure works. Now, I know that we all know that there's been a little bit of a slight lag now in people's interest in getting vaccine. So we need all your help in doing this. And Secretary Collins is going to tell you a lot of what we're doing. But let me show you one more math slide for those of you who like this sort of thing. You know, can we really do 42,015 fully vaccinated people per week? So I've shown you the eligible population. If you multiply that by our target, we have to vaccinate 1,008,363 people, okay? And I used the dashboard last night, so it may even be updated today. We already have 961,000 people who've already gotten 1 dose. And we already have 690,909 people, which is the 41.1% that have had the full vaccine series. So all we would have to do to meet this target by the end of June is one, vaccinate all the people who've only gotten 1 vaccine and need the second. And we might not get all of them, but just work with me here for a minute. That would only leave us 46,729 people. So I think this is clearly doable. It's going to take extra work, and Secretary Collins is going to give you a big update on a lot of things the state is doing to get us there. So what does this all mean? What would this look like if we adopted these criteria? Alex, next slide, please. So on your left, you have the map that we released last Wednesday. We had 14 turquoise counties, 3 green, 15 yellow, 1 red. There was some concern from folks about who had to go from green or turquoise to yellow. And we just, as an exercise or an experiment, we went back to last Wednesday and applied the new criteria. And we used a 35% vaccination rate because it's 5% every 2 weeks. So we went back to last week. And this is what the map would look like using the 10 cases per 100,000, the 7.5% vaccination rate, and 7.5% test positivity rate, and a 35% vaccination rate. And it looks really good. 24 turquoise, 6 green, 3 yellow, no red. And so we believe that these changes will do a number of things. One, create more stability. We don't want to see counties bouncing back and forth. 2, it will, hopefully incentivize all of us to work to get everyone vaccinated, because that's our best way out of this pandemic. And I think there's a real opportunity for communities to be involved in this that I think will be very helpful. And let's go to my last slide, Alex, and I'm going to turn it back to the governor. You've seen this every day, every press conference. I don't want to read everything on it, but there are a couple of things I want to emphasize. Get registered if you're not already. Get vaccinated. It's really important for you and your family and your community. We do have variants, so vaccination becomes more important, and sticking with the masking requirements more important as well. And I just want to emphasize today, I think one of the chief things we can do right now, particularly with schools reopening, and this is really to you parents who are watching, please do not send your child to school if they have any symptoms: fever, breathing trouble, loss of taste or smell, muscle pain, nausea, diarrhea. Kids have more GI complaints than adults, so watch for those, even headache or severe fatigue. Please stay at home. That's the best shot we have at preventing further spread. And with that, I think I've gone over the fundamentals. We can deal with specific questions in Q&A. Governor, I'd like to turn it back to you. You're on mute. Governor, you're on mute. Hey, Governor, you're on mute.
I tell you, if you don't do this every week, you lose practice. So I apologize. But the takeaway from Dr. Gray's presentation is vaccines really are the game changer in terms of giving us the COVID safe opportunities to do more, add more risk into our daily lives, and to show you that we really are in that home stretch. And typically when we make modifications, we alert the general public, and then it's a forward thinking so that we hold that data set for a couple of weeks. I'm announcing that if in 9 weeks, and we know we're going to do this, we'll be at 60% at least vaccine rates for 2 doses. There is no reason that starting this Friday, this is where we are because of our vaccination rates. It means that most of the state is turquoise, most of the state green, a few counties. And as we get through that vaccine data, right through the end of the week and next week, I have no doubt we'll see improvements and opportunities statewide. So again, it will go into effect this Friday, April 30th. And the bottom message is get scheduled for your vaccine. You can go to vaccinenm.org. Congratulations, New Mexico. We are doing it. We are conquering COVID. Dr. Collins, you want to give us an update about our vaccine work and make sure that we're encouraging every New Mexican who is yet to get vaccinated to make sure that they do so as quick as they can.
Thank you, Governor. Absolutely. So good news, New Mexico continues to lead in the nation with vaccine distribution. 57.5% of New Mexicans 16 years of age or older have received at least a first shot, and nearly 42% are fully vaccinated. Next slide. Just to want to reiterate, going to vaccinenm.org, you can now schedule your own vaccine appointments, including your booster shots. Next slide. Please keep in mind the vaccine is free for everyone, and you do not need a social security number or government ID to receive the free COVID-19 vaccine or any treatment or services. Next slide, please. So I want to make sure that we're clear that we do not share immigration status information with the federal government. We do not share that information. Vaccine sites are safe. Next slide. So if you need support getting scheduled, we have some options here. You can call 1-855-600-3453 and press 1 for English, 3 for Spanish. Seniors and those with disabilities can call this 1-800 number. That's 1-800-432-2080. And that number will provide you with support with registration and scheduling. Also know that Department of Health and our Aging Long-Term Services Department, we're calling to schedule seniors 60 years of age or older, are also New Mexicans with disabilities and anyone who requires special accommodations. So we are also reaching out to that community to get them registered and scheduled for their vaccine. Next slide. And please note, all 3 vaccines, Moderna, Pfizer, and J&J, are safe and effective. So please take that first vaccine dose or first vaccine you're offered. And if we have more vaccines in arms, we reach that 60%, we'll keep more of our loved ones from being hospitalized or even worse, dying due to COVID-19. And please continue with best COVID practices. And you saw the nice graphic that Dr. Scrace displayed about mask wearing, and make sure you're washing your hands, keeping your distance, and doing all the things you can do to keep us all safe. Next slide, please. So nearly 900,000 New Mexicans have registered for the vaccine. So please register and self-schedule today, vaccinenm.org. Next slide. So I wanted to highlight what was alluded to by Dr. Scrace, this idea of getting more shots in arms. One of our key important partners are primary care providers, and we are supporting them to administer vaccine. We really need to have our primary care providers with vaccine doses in their practices. And we are really encouraging, and we actually adamantly state that primary care providers will vaccinate their patients. And keep in mind, as a primary care provider, I recognize that we are in a unique position to hold intimate, meaningful conversations with our patients about vaccination. So I'm going to encourage all of my fellow primary care providers, reach out to your patients, encourage them to get vaccinated, and offer vaccinations to patients who are visiting your facility for other reasons. So be very proactive, and I'm going to thank you in advance. Next slide, please. I also want to highlight, as we talk about reaching various populations, you know, it's not one size fits all. We've got to tailor our messaging, our marketing, our outreach to a given community, whether it be employers, those who are homebound. But we have a great asset in the state with community health workers and community-based organizations as a way to increase vaccine access and education. So currently DOH is partnering with community health workers and local community organizations to identify barriers to vaccine, to help with registration, and to educate to increase vaccine confidence. And here we have a picture of some of our community health workers on the left, and then also our New Mexico Mobile Equity Team. And once again, big thanks to the National Guard and other organizations for partnering with us. Next slide, please. So if you have questions, we are here to listen. We have town halls, we have a network of our community health workers, And we have multiple outreach methods. And so we are really open to having a dialogue, listening, and really understanding what the concerns are. And we want to provide clear, validated, scientific information about COVID-19, about vaccines, and related health topics. Next slide. So really happy to highlight our Trusted Voices campaign. We've had more than 60 community leaders share their vaccine experiences, and you can view these using social media, vaccinenm.org/facts. And I'm going to stop here and allow us to play one of our videos from Bishop Cooper. And I'll pause there. And Alex, if you can get that going, thank you.
Hello, my friends. This is Bishop David C. Cooper, President of the Ministers Fellowship of Albuquerque and Vicinity. I want to invite you to take the shot. What shot? The vaccine shot. That's the only way we will have a shot. Listen, all of the citizens of the state of New Mexico, we need to come together so that we can defeat this deadly virus. Listen, of course, historically, people of color, we have been hesitant to take vaccine shots. But I want you to know that this shot is safe. The shot is for the betterment of our community and the safety of our community. So go ahead, there's a registration button. Go and hit it and get registered and take a shot.
Fantastic. Thank you, Bishop Cooper, one of our trusted voices. And I'm going to wrap up there with the final slide. So again, I want to thank our state for all that you're doing. If you haven't gotten vaccinated, please do so. And now I'll pause there and we'll open it up for questions. I'm going to turn it back to our fabulous leader, Governor Michelle Lujan Grisham.
Very nice words. Thank you very much, Dr. Collins. This really is a monumental achievement by all of us. And I certainly, while I don't want to lose the focus on, we've been saying light at the end of the tunnel, we're getting there, we are basically there. We certainly don't want this to be a message about letting your guard down. We certainly want to remember all those that we've lost and their families and businesses and individuals who have financially struggled during this pandemic. Those are real losses. But our efforts have in fact paid off. This is a state that is making data, evidence-based decisions that are safe, that allow us to embrace, right, as many opportunities as we can make available, all of them, in just 9 weeks from today. And I am delighted to be in this position and am thrilled with the work of so many of our partners. And at the appropriate time, 9 weeks from now, Dr. Scrace, Dr. Collins, we need to bring in every one of our partners and thank them directly and personally. And as many of the national press articles have stated, our success has been no wrong door, everyone working together and being very clear about having a data-driven response to conquering COVID. So with that, I thank everyone so very much. I'm sorry about some of those early technical difficulties. And Nora, we're all ready for questions.
Thank you, Governor. I will start with Matt Grubbs from New Mexico PBS. Matt, go right ahead.
Thanks, Nora. Thanks, everyone, again, for the availability. Could some of you spend some time talking about the difference between the 60% vaccination rate and herd immunity, how you see those two fitting together? And I'll stop there. I bet everyone else has all my questions.
You got it. And Dr. Scrace was quick to raise his hand. That is the goal, right? To defeat COVID in every aspect that we can, given that it's a virus that's not going to go away. You want to achieve herd immunity, which is people are vaccinated and or folks have gotten COVID and they've conferred, by virtue of having COVID, they have antibodies, they are also have some immunity. We create an environment where enough of us have that immunity that we are basically not allowing that virus to find a host, which means it doesn't mutate as often. It's not as present, right? And we control it to the highest degree possible. That 60% vaccine rate with all the other individuals who got COVID, we're in that herd immunity space. And I want Dr. Scrace to clarify exactly what those numbers are and aren't, and why 60% gives us the confidence in 9 weeks from today to be open.
Yeah, and Matt, thanks for the question, because it's one that's on everyone's minds. And as usual, I'll start with a few caveats and then hopefully get to answering your question. One is, herd immunity, the definition I'm going to use is similar to what we have for influenza. It's not completely gone, but we can live a reasonably normal life, and the spread of the virus is generally under control. That being said, no one knows what percent of a population has to be vaccinated to truly reach herd immunity for coronavirus. We just don't know. And as a matter of fact, we were musing on this the other day that probably New Mexico will be telling the rest of the country what that number is, because we're going to get there first. We don't have anybody out there that's way ahead of us in vaccines. And lastly, we do have some of our own data. When we vaccinated preferentially people in nursing homes first, when we got to about 70%, we began to see this sort of meteoric drop in cases and particularly deaths in nursing homes. Teachers, when we vaccinated 70% of teachers, we did vaccinate 70% of teachers who registered in the system, and we've seen a very, very minimal, almost inconsequential increase in teacher cases so far as schools have reopened. So somewhere in the back of my mind, I've got the number 70%. And then how does that fit with 60% of eligible people? Well, you've got that 60% of eligible people, which isn't our full population, but it's getting up there. I think we will have, if you look on the state vaccine site, you'll see that at any given time, we have 15 to 17% more people who've gotten their first shot than people who are fully vaccinated. So in my head, at least I add, let's just say that's 15. Now we're up 60 plus 75, 75% of eligibles. There are the people who have gotten COVID. We're still sorting out what percent of them are getting vaccines, but let's just say that's, by then, say 10% of New Mexicans will have had COVID, where I think we're at 9.3 or 9.4% right now. So you get up to a number over 80%, and I think most of the epidemiologists that I talked to today feel like that's a place where we can be very optimistic. But again, we probably, and as we predicted in January, and as the news has been releasing this week, a booster shot, and probably an annual booster shot, is very likely in our future because of the mutations of the virus, and we'll use that as an adjunct to the immunity that our population already has. Thank you.
Thanks, Dr. Scrace.
Thank you, Governor and Dr. Scrace. And I'll just thank our media partners for being with us, and remind folks we have many questions to get through. So your fellow media members appreciate you being concise with your questions. Next, we will go to Julia Goldberg with the Santa Fe Reporter. Julia.
Yeah, thanks so much, Nora, and thank you, everyone. Okay, Julia, try to be brief. So, Dr. Scrace, your slides went by a little quickly for me. I wasn't sure if the percentage of people in New Mexico who have missed their second dose is comparable to the 8% average, or if it's lower, because I couldn't do the math that quickly. But I wondered what you'd say to people such as the person I spoke with earlier today who said, why should I get a second dose if the first one has left me 80% immune? And I said, they think the second dose will have more durability. And they said, but isn't it true that we're going to need to get more anyway? And then I stopped answering questions because I didn't actually know the answer. So I was hoping you could sort of, I don't know if that is a common concern or common reason why people are not getting a second dose, but maybe you could speak to both of those. Thank you.
Sure, and I'll let Secretary Collins speak on the vaccine hesitancy piece. But Julia, you're getting close enough to join the governor as somebody in the state with an honorary medical degree.
Well, I was just going to say that it's completely unfair to Nora saying we've got to be timely and, you know, manage our time effectively. But Julia, yeah, I think you're going to, and a PhD in statistical or data information. And if you want to, you know, if you're interested in a career with Dr. Scrace or Dr. Collins, I'm sure they can make that happen.
Yeah, exactly. So Julia, couple things. One is the evidence says, well, the evidence we have is really focused and based on full vaccination. Those numbers that float around all about, you know, I'm 60% or 70%. I don't think it's 80, but, you know, with one vaccine, you know, that's a sort of a byproduct of the research and not the end result of it. And the percent of people getting COVID in those intervals, not as clear. And so we're going by the evidence. That's why we're emphasizing full vaccination. Other states are just off and running with just one vaccine and you see what happens, but there isn't evidence for that. I think the second thing is, you know, let's say it was 70%, you know, having a 95% immunity is a lot better than 70. And that also goes for hospitalization and death. And so, you know, people who get COVID, you know, we've seen a case fatality rate of 4%. That's pretty high, higher than most other things that are around. So protect yourself, protect your family. And then lastly, I would just say, I suppose you could extend that argument. Well, if I have to get more shots in the future anyway, I mean, the next argument is, well, why should I get any shots at all? And we think the evidence in our own state and in our own population and subpopulations is very strong. The full vaccination is the way to go.
Right. And if I can do it on a non, you know, the data side from Dr. Scrace's or Dr. Collins' perspective, but Julia, for folks that you interview and talk to, you know, the opportunities as we do the modeling to determine what we can do safely, having both those vaccines minimizes the ability for this virus to move around. Minimizing is conquering. Conquering means we're open. And all of the activities, personal and professional, right, that are meaningful to us as individuals and critical to us as a state can more readily occur. And we talked about not wanting to anywhere in the world, right, have to bounce back or to have a resurgence. And the way that we do that is we follow the evidence. You need the 2 vaccines. That's the most efficacious if it's a 2 vaccine environment. If you don't want 2 vaccines, and again, we want you to take the vaccine that's available, but there is a 1-shot vaccine available. And Dr. Collins is going to ground me for creating an environment where people can choose. Our effort today has to be, this is the same issue. Our job is to protect New Mexicans, save lives, keep people from being sick. We do that by following the vaccine data exactly the way that it is. And all of us need to do our responsible part. And we have been. So anything that we can do as a team, you, the media as communicators, and our experts here in the state of New Mexico, we need to keep encouraging people to follow the guidance for vaccines and to get the full course, whatever that is, done. And when and if and when there's a booster, count me in to register immediately and be ready for my booster, probably from my primary care, as soon as it's available.
Yes. Thank you, Governor and Dr. Scrace. And I just want to add to that if we're talking about boosters being in our future, you absolutely want to get the first and second shot of Pfizer and Moderna, because then that booster would add on top of that. So it's really important to complete the vaccine as it's been manufactured. And I want to add, regarding if anyone's hesitant or kind of considering, do I really want to do this? Do I have to? You know, get the facts. Talk with your primary care provider, talk with your pastor, talk with a friend or family who has been vaccinated about their experience, and really tap into those folks who you trust, those trusted voices, and make an informed decision that you really want to protect yourself and your loved ones.
Thank you, Governor and Secretaries. Next, I'll go to Dan McKay with the Albuquerque Journal. Dan, go right ahead.
Hi, thank you for taking our questions. Can you address what it means to reopen on June 30th? Does that mean that there would be no, that all the public health restrictions and emergency health orders would be lifted? Or will there be something that kind of hangs around beyond that date? What do you envision as reopening on June 30th? Thank you.
Think about all of the capacity limitations, right? Those are all going to go away. So having to navigate in our red, yellow, green, turquoise, and to think about that, we are there. We've graduated. But COVID safe practices have to stay. So that's why we really wanted to go over, and Dr. Scrace spent meaningful time talking about the CDC guidance and showing you those risk factors. Remember, again, there is a segment of our population that is not eligible for a vaccine, 0 to 15. And so we have to do everything in our power to protect that population. And to continue to make sure that we minimize the opportunities for this virus. So these two things stay. We will continue to provide guidance about masks indoors and about social distancing and COVID safe practices. At 100% capacity, that becomes less restrictive. So I might want to sit a little bit further away from the indoor dining table, but it's not going to be a mandated aspect. That's what being open means. And we're going to keep the public health emergency. Why do that? Because COVID is still a deadly virus. It's still out there. And as long as we have that emergency order in place, it does allow us to continue to draw down federal support and federal funds, not the least of which allow us to continue to provide vaccines, as an example, for free. But there are many, many other benefits. Premature to discard those benefits. Premature to tell people that mask wearing and public health precautions are no longer needed. They are. And this is just an example, not mandated. You saw the CDC guidance. We're adopting that. Dr. Scrace said he's going to go outside and exercise without a mask. I am not. I am not going to go outside and exercise without a mask. I'm going to continue to participate in the highest level of public health practices. You're going to hear us continue to talk about the benefits of that, but they are required in schools. They are required in indoor activities. And while we're open, we're going to help businesses continue to think about ways to have 100% capacity and to incorporate, right, social distancing, because we think that those don't have to be mutually exclusive, and we're going to help people work through that. But we're open. Dr. Scrace?
And I would just add that I was going to mention the mask part of that too, that probably that will be one of the last things to go. And in my own defense, Governor, I'd like to clarify that when I do go out walking in Placitas at 5 in the morning, that no one else is around, just for the record.
Thank you, Governor and Secretaries. Next, I will go to Brittany Costello with KOB. Brittany, go right ahead.
Hi, thank you guys so much. So I do want to clarify something. I am not super great at the data, so I'm just going to say that. But I'm looking at some of the slides. And so I'm going to start with just a clarification question. So the red, yellow, green, turquoise changes slide, where it says the effective date May 4th, that should read April 30th. Is that correct? And then in that hypothetical map color coded change, the vaccination target is at the 35%, and the other slide it's at the 40%. So what will be taking effect on the 30th, the 35 or the 40%? And then with another question, I just wanted to ask about, we were told about 2,000 vaccine doses have been wasted so far. I just want to know, like, what does that number mean to you guys? Thank you.
So I'm going to do your last question a little bit and then give that to Dr. Collins. Look, we don't want to waste a single vaccine. The extreme cold storage, the appointment process, the priority populations, you know, it is a lot harder to manage this vaccine program than I think most folks around the globe understand. And it is one of the reasons I'm so proud of this team and every single private partner, because they have done arguably the best job on the planet, getting vaccines out, making it effective, efficient, getting to our at-risk and equity populations, and not wasting vaccine. But I know Dr. Collins will do that. Part of the difference between April 30th and May 4th is Dr. Scrace is required, right, we make changes. We give people some time to embrace those changes. We make sure the data stays consistent. And then in a future, right, we give you 2 weeks, then it's available. I overruled, which I have not done in a year and 7 months, the modeling team and declared that, you know what, we're ready this Friday. For all of the counties that can, and businesses that can move in to the upgraded upgraded green and turquoise and yellow, let's let them do that. Because, why would I do that? Because my team and your private sector partners are getting enough shots in arms that we are continuing, right, to meet and or exceed those projections. And so I'm incredibly confident that we need to reward everyone's success and participate in that home stretch. So I just declared that today. Dr. Scrace wasn't really sure what I was going to do. So you're welcome, Dr. Scrace. I made your slides inconsistent.
No, thank you, Governor. Actually, when I presented the slide, it was true that it was May 3rd, but then after that, you changed it. I did want to make one technical comment too, because it's a really good question, Brittany, and that is what the map was that I showed that the governor is putting into effect on Friday is the April 21st ending period data that we have added the vaccine rate to. And so we still have the plan next week to run the report, which is the every 2 week cycle with the 40% target. We applied the 35% target to the one which is now whatever it is, 8 or 9 days ago. So so I appreciate you bringing that up, because going forward, but the one thing that is kind of cool about it is the rule about turquoise still applies. So the fact that the governor's chosen to make this effective on Friday actually locks every single turquoise county into 4 weeks of turquoise ness. Thanks. And I think Tracy may have a comment on vaccine wastage as well.
Yeah, thank you for that. And certainly we do everything we can to not waste vaccine. Inevitably it will happen, but we put in a lot of measures to prevent that from happening. And one thing that's happening now are the manufacturers are going to provide smaller allotments, so that if you open a particular box, you're not committed to so many doses in that particular allotment, and that will tremendously help us. But I really appreciate the question. Thank you.
Thank you, Governor and Secretaries. Next, we'll go to Chris McKee with KRQE.
All right, thanks a lot. Hopefully you can hear me. Yeah. Thanks a lot. I guess 2 questions here. What if we don't get to 60% by June? If we don't get to that 60% vaccination goal, are you still willing to put an end to restrictions? And if we do fully reopen and meet that goal, can every business that's been closed then fully reopen? I think of like movie theaters right now are in the color-coded criteria. So does that mean, like, say, movie theaters in Bernalillo County would all be able to finally reopen? One more quick question to add. Is kind of this change sort of an acknowledgement to some extent that if we don't consider vaccinations, it's going to be really hard for these counties to get out, like say Bernalillo County, very populous county, to get out of yellow?
So I have a incredible confidence in our ability to get to 60%. And so is there a possibility that something dramatic occurs? And then you look at the data. What are the case counts, right? What are the rates of infection? That's why you have a whole thing of gating criteria. It's not just vaccines. But vaccines are a huge game changer, and that gives us that confidence. And in fact, we're all waiting, right? As things improve, what are all those improvements collectively that allow you to make the next set of decisions? And we've been really successful over the last year and a half plus, that using a modeling team and using evidence-based, data-based criteria to make these decisions, I feel incredibly confident. I do want to point this out, and it's just because it's really important. Vaccines are the way through COVID, no question. And getting that data included took real work. And I know that I always want it to be simpler than it is, Chris. I do that all the time. Why can't the modeling team tomorrow tell me how safe it is to do X? And figuring out how many folks who already had COVID are also getting vaccines, people who got vaccines somewhere else where we don't have the data, getting the federal data available and transparent to us county by county was no easy trick. And it's been a complaint by states to the White House, who inherited a data system that didn't quite work, Tiberius. I mean, it's been really challenging. So we had it all in a place where I am incredibly confident. I want to point out, however, that you had many countries, right? You had New Zealand, you had South Korea, we had Australia, who without vaccines conquered COVID using public health practices. So when we did the red, yellow to green, I don't want anyone in the state to think that we assumed that we would be in a situation in turquoise that no counties were going to be able to graduate. We modeled, if you use these public safe, COVID safe practices, arguably you get to a place where you're completely open as well. It's hard. Human nature, human behavior as it is, borders, people moving in and out, changes, differences in Colorado and Utah and Arizona and Texas, any number of those issues in interstate highway system, we don't have the same opportunities as the places that I mentioned to control all of those public health practices. But vaccines allow us to transcend those obstacles in this country. So I feel incredibly confident. And yes, to your point, does that mean that statewide on June 30th, I can go into a movie theater with my mask on? Yes, that's exactly what it means for the entire state. So we all know what Chris McKee is going to be doing. He's going to be going to a movie on June 30th or first thing on July 1st, I'm guessing.
Thank you, Governor. Next, I'll go to Matt Reichbach. Matt, you're unmuted. Go right ahead.
All right, thanks. Yeah, I just want to clarify a couple things on the mask mandate. I just want to make sure that this is a formal change of what the state is saying in alignment with CDC. And also, does this include adult and youth outdoor sports? Do folks who are participating in like softball or soccer or baseball, will they still need to wear masks? Thank you.
I'm going to have Dr. Grace back me up, but let's do the kids for sure, right? Because they can't get vaccinated. I'm just going to do a generalization, even though 16 to 18-year-olds can be vaccinated. And remember that group sports are higher risk. And so we want to encourage that mask wearing. So we're going to keep that mandate in place for youth sports and for adult sports. Dr. Grace and we want to strongly encourage them, right, to continue using masks because they may have kids at home and you're engaged in the greater community. Dr. Grace, do you want to talk about that? So much like when we changed the public health order to meet the legal requirements of houses of worship at 100% capacity, we also said, but we still want you, right, to socially distance, to minimize that capacity, and to wear masks. You got to do all those things, even though we've made this announcement, because it's a much better public health practice than not doing it.
Yeah, thank you, Governor. And just a couple clarifications. I got one more that I forgot to do earlier. One is most children will be unvaccinated and therefore will still have mask requirements for sports. It's actually, we're believing, and national data suggesting, case reports, that it is higher risk. So that will still be required for unvaccinated people. Second is I failed to define small group. It's a phrase in the CDC guidance that the CDC purposely failed to define. And so for New Mexico, for at least the near future, we're going to link that to the mass gathering size of the color of the county, or 20, whichever is less. What that means is red counties, that small group is 5, yellow counties it's 10, and green and turquoise would be 20. So effectively we'll go to 20. And if you read the CDC guidance in that infographic, and you see the word small, that's how that'll play out.
Thank you, Governor and Secretary. We'll go to Gabrielle Burkhart with KRQE. If there's any reporters who haven't asked a question yet, please raise your hand.
Okay, thank you. Can you hear me? Mm-hmm. 2 quick questions. One is a clarification, Dr. Scrace, maybe this one's for you. On the red, yellow, green, turquoise changes, it says 40% and increases every 2 weeks by 5%. So does this mean that each county's vaccination rate criteria will increase by 5% every 2 weeks in order for them to stay in that color? Okay, you're nodding yes. And then so my second is vaccine related. Can you tell us how many confirmed COVID cases there are among fully vaccinated New Mexicans? Were any of them hospitalized or died? And then what have we learned at this point about reinfection? Thank you.
Yeah, I'm going to have Dr. Scrace take but it's about 271, what we call breakthrough infections. There have been some hospitalizations. Unfortunately, there's been 4 deaths, and I want Dr. Scrace to talk about what we know about that, what we're doing in our sequencing, all of the work around those issues that we are productively engaged in. Dr. Scrace. Yeah, Gabby, great questions. And I was nodding my head, and then you said one thing at the very end that I didn't agree with, so I want to clarify. If a county is turquoise and they're meeting the vaccination requirements, but then they fall behind, but they meet the other 2 metrics. Remember, now it's only 2 out of 3. So they would stay turquoise. So it isn't absolutely necessary to keep that requirement to stay turquoise, but it's a 2 out of 3 thing. So I want to say that. On the vaccine breakthrough cases, Governor, as usual, is right, 271. That represents about 4 people out of every 10,000 that have been fully vaccinated. People more likely to have breakthrough are 16 to 59-year-olds and people greater than 75. There's a slight race ethnicity increase in chance of having that happen for white, non-Hispanic individuals, and females a little bit more than males. 50% of these people have symptoms, 50% don't. 72% have underlying conditions so far of the 271, and about 13% with an immune disorder. Governor mentioned hospitalizations. 23 people have been hospitalized after sometime after 2 weeks after their second COVID vaccine. Only 5 of those appear to be related to the COVID itself. And there were 4 deaths in this group, 1 clearly related to COVID, which is sad, but much lower than what we've been seeing in terms of death rates. 1 clearly not related to COVID, and 2 are still being investigated. And I know you didn't ask for this, but often these cases of repeat COVID don't have much virus in their nose, and so your vaccine breakthrough, they're very mild cases, and so it's hard to sequence the virus because we don't have enough viral. But we have seen variants, in particularly the California variant, in the breakthrough cases so far.
Thank you, Secretary. Next, I'll go to, oh, he just disappeared on me. Okay, I'll go to back to Chris McKee with KRQE, and I have one more immediate person who has a question but isn't showing up, so let me work on that. Chris, to you.
Thank you very much. Just one other question related to schools. This is kind of in consideration when you think about businesses and how if they have a certain percentage of testing going on through businesses, they're able to stay open, as I understand, even if COVID cases are maybe happening related to those businesses. So, and correct me if I'm misrepresenting this, please. But schools, I know, have that really slim threshold for the number of cases that they can have before there's a shift back to all online learning versus in-person learning. With these kind of changes here, is there any consideration in readdressing perhaps that small threshold of having that shift to all online learning if there's a certain number of cases in a school? Like, for example, El Dorado was a school recently that had to go to all in-person learning. Thank you.
It's a really important question. I mean, schools are a tough environment given that we have a population that's not eligible for a vaccine. And they are indoors by and large. And so you have all these high risk factors. We want more stability in the schools, less virus out in the community, which is addressed by our COVID safe practices and our vaccine rates. The more stable the environment is for in-person learning. I know that the modeling team is, looking at that, because when we introduce risk, and we've said 60% vaccination rate, we're open. This is incredible news. We'll have summer school, other in-person learning environments. We've incentivized schools to do extended learning. And of course, August is right around the corner for the regular school season to start again. We need stability in the classroom. So we're looking at that, but I fully expect that you'll have decreased risk and increased safety given the vaccine rates. As they continue upward, we should see less and less of the virus present itself in schools. Again, the virus will never disappear. It is with us forever. It is how we keep conquering and beating it back. That's the key to our success. But you are correct that there are some nuances in schools that will require more attention from the modeling team, and you should expect to hear more about that in the upcoming press conferences. Dr. Scrace, did you want to add?
I do. Thanks, Governor. And we can commit to giving you more information going forward. I think it's important to remember we're on day 23 of full school reopening in New Mexico. We are getting a weekly report on cases, and I alluded to that earlier, for most of the increase in cases we're seeing in kids. So we're constantly looking at this, constantly reevaluating, but we probably need 6 weeks of experience under our belt before we can be more confident about whether we want to change those regulations. And last, there will, I think, well, let me just say it this way. We're really closely reevaluating testing of asymptomatic people. You mentioned that screening testing in businesses, and looking at exempting those who've been vaccinated from that testing. On the other hand, in congregate living situations like nursing facilities, assisted living, prisons, it's a different set of dynamics. But that's all under investigation right now, and we'll have more for you in the coming weeks.
Thank you, Governor and Secretary. Governor, I will hand it back to you to wrap us up.
I want to close by, frankly, doing something that I don't do enough. I want to thank the Human Services Department and Dr. Scrace, the Department of Health, and Dr. Collins for, frankly, their incredible leadership. I lecture them every day about they're not allowed to open their emails and solicitations from any other partners or states that are trying to steal them. We have been dedicated, vigilant, committed to conquering COVID. We have been incredibly successful in those efforts. Saving the lives of New Mexicans has been a very easy threshold for us from which to make all of these decisions. And I am proud of the state. We've been doing this all together. We've made the differences, and there must be something about this remarkable day because it's raining in Santa Fe. So I celebrate the moisture. I celebrate their success and dedication. I celebrate that New Mexico. I want to give the media, I work hard to do that, a real plug. I would say that some of our, if not a great degree of our vaccine success is because you're reporting the facts, you're asking questions, you're allowing us to translate it to an individual in a community who couldn't get registered or had an issue or has hesitancy for one reason or another, and we can address that. Keep doing that. It creates credibility and confidence in this state. We are doing it right. This is incredible. We are, in my opinion, because not everybody does this sophisticated modeling, and Dr. Grace is exactly right. We've been ahead of the CDC. We are, in fact, the first state to make these declarations based on our COVID safe practices, our red, yellow, green, and turquoise response, our county-based data and modeling, and our vaccine success. That using those safety guardrails, we are successfully reopening. We aren't just making a declaration that's not based in public health evidence. And I believe we're the first state to be in this position. And I am incredibly proud to be in that position today. So congratulations, New Mexico. And thank you so very much for doing all you do every day to make this a reality. Thanks, everyone.
Thank you.